Hello and welcome to this special episode on the cardiovascular system and most importantly the heart, which is the most important organ of the human body. With me in the studio is Dr. M.D. Dixit, a very senior cardiac surgeon, and Dr. Prabhu Halakatti, a very senior cardiologist. Welcome doctors to the show. So Dr. Dixit, what is the cardiovascular system all about?
Cardiovascular system, as the name indicates, it consists of cardiac, that is the heart, and the vascular system is the heart. When it pumps the blood through the blood vessels, it reaches each and every organ in the human body.
Right.
So the entire system is called as the cardiovascular system. And heart being the pump, it sends through the blood all the oxygen and the nutrients which are required to the different organs of the body.
Right.
And then all the waste material is connected to the venous system and it comes back to the heart. And then it goes to the lung where it gets oxygenated, it gets purified, and then again it comes back to heart to be recirculated.
Right.
So this entire thing is called as the cardiovascular
system. So any diseases that affect the cardiovascular system directly or indirectly would affect the other organs in the body?
Of course, it will affect. It will have its own effect.
Right.
Usually the lungs and the hearts, they work in pairs.
Yeah.
So we say that if the heart is affected, the lungs also gets affected. If the lung is affected, it gets the heart also gets affected. But in the end, if both lung and heart are affected, then the other organs
start taking the brunt of it. So doctor, what are the different diseases that could affect our heart or the cardiovascular system in general?
Normally we divide cardiovascular system disease into congenital heart disease, which is the defects which occur at birth of a child, like a hole in the heart, or when the child becomes blue, what we call it as a blue baby syndrome.
Yes.
The other is when they grow up, then they can have these joint pains, and then that can lead to a heart disease which we call as a rheumatic heart disease.
Right.
The third big variety is what we call the common one, which where people get heart attack. We call it as the ischemic heart disease. Ischemia means less blood supply. So because of the blockages in the coronary arteries, the heart gets less blood supply, and because of this less blood supply, it can lead to a heart attack. And the other thing is, which is nowadays, which we are seeing more and more often, is a heart failure.
Right.
So these are the different types of heart diseases which we get.
Yes. So Dr. Prabhu, what are ischemic heart diseases?
Ischemic heart disease, as sir was telling, our heart is having a blood circulation.
Right.
These are called as coronary arteries. We have a left side, we have a right side, two coronary arteries, which supplies to the heart muscle.
Right.
So whenever there is a blockage happens, these blockages are basically because of the cholesterol, the fat material what we eat in the food, it goes and deposits on the coronary arteries.
Right.
So whenever the blood circulation blocks more than say around 90% or 100%, patient develops a heart attack. So this presents as severe chest pain. So invariably ischemic heart disease, what we call as angina. So angina is initial form, patient develops a chest pain. When he walks, he gets a chest pain and he rests and the pain comes down. Whereas in a patient, when the block develops 100%, he comes with severe retrosternal or chest pain, or he can have sometimes jaw pain or back pain. And a sweating, profuse sweating. These are and sometimes they have an vomiting and giddiness. These are the common symptoms of an heart attack. But especially in a diabetic people, we must remember this, everyone who has a diabetes, because 80 to 90% of the heart attack what we get is in a patient who is already having a diabetes. So they don't develop a chest pain because the nerves supplying to the heart is involved, they are damaged. So they basically present with breathlessness, dyspnea, we call it as dyspnea. So that is very, very important.
Right.
So profuse sweating, even dyspnea can be a symptom of an heart attack.
Dr. Dixit, do you feel that ischemic heart disease have more prevalence in the Asian countries, or do you see a specific age group where the prevalence is more?
There have been a lot of studies which show that Asian population has a higher prevalence of ischemic heart disease. Not only that, people who have migrated from India and have gone abroad and settled in US or in Europe,
Right.
their prevalence is also higher than compared to the native people.
Native people.
And definitely there is a higher prevalence.
Right. So what are the causes of ischemic heart disease now that we know the symptoms?
Causes, as we said, that the commonest cause is atherosclerosis. Athero means it's like a porridge-like. Athero, the word atheroma comes from the porridge-like. So it's like a porridge-like material which gets deposited in the coronary arteries. Coronary means the blood
supply,
the blood vessel which supplies blood to the heart. Once they get deposited, normally they travel through the blood. All these cholesterol and other things, they travel through the blood. But sometimes they enter into the wall of the blood vessel. And once it gets into the wall of the blood vessels, it creates a sort of inflammation, a sort of reaction, which leads to accumulation of lot of material there. And this protrudes into the lumen of the blood vessel, obstructing the flow.
Right.
So that leads to the heart attack. Now, what causes this atherosclerosis to happen is little different material. We normally say that nobody knows why it happens.
Okay.
But we always say that there are some risk factors which
could lead to
which
developing
increases the prevalence of these heart attacks or ischemic heart disease.
Right.
Now, one of the thing which is the commonest is the smoking. Now, invariably, if we want to prevent heart disease, we always say you have to stop smoking.
Right.
The second one is the incidence of diabetes.
Yes.
Then hypertension, obesity. Nowadays, most important thing is sedentary lifestyle, not exercising, sitting in one place. So this is also a disease now.
Right.
Then having high cholesterol. So these are some of the reasons which can, but also we can say that hereditary does play. If the parents have got heart disease, the incidence, the chances of the children getting heart disease is also high. So these are various risk factors, we call it.
Yes.
And these are the risk factors which lead to heart disease.
Right. So doctor, do you think stress plays also a role in developing ischemic heart disease?
Of course, stress is a very important part of creating this heart disease. Not only is that, stress also creates hypertension. It also leads to the areas where we are more prone to get diseases, different type of diseases, even infections. Now, this happens because during stress, certain chemical
can be secreted.
They are secreted. Hormones are secreted, and these hormones tend to increase the blood sugar level. They try to increase the blood pressure, and these are the effects which last for a longer time, and then they lead to what we call it as heart disease. So a little amount of stress can be tolerated, but a persistent and continuous stress
puts a strain on your body.
Leads to all these problems.
Right. So doctor, when a patient presents with ischemic heart disease, or as you would say with heart attack, what are the different treatment modalities that are offered to the patient?
Whenever a person comes with the history which is suggestive of ischemic heart disease, there are various simple tests like we do check the blood pressure, we check his weight, we check his blood sugar, we do an ECG to see if there is a resting ECG changes.
Yes.
We do an echocardiography to see whether there is a effect on on the heart. There is something called as regional wall motion abnormality or heart function, how it is. Then in some cases when the patient is stable, we try to do treadmill test. We make him run on a treadmill and then take his ECG. And ultimately the other part which we can do is coronary angiography. So that is the gold standard investigation, wherein we inject dye into the coronary arteries and we try to find out if there are blocks in that.
Right.
But a non-invasive nowadays, which is there, is a CT coronary angiography. We do a CT scan where these dyes are injected, and then the coronary and coronary artery is picturized.
Yeah.
And in that we try to see whether there are some blocks or no.
Right.
So these are some of the investigation which has to be done.
Right. And Dr. Prabhu, what is an angioplasty and when is it done in ischemic heart disease?
Now, when we always do an angiogram, we find out that the patient is having a blocks.
Right.
So it can be a 1 artery block or 2 artery or 3 artery. We call it as single vessel, double vessel or triple vessel. Whenever a artery has got a single block or maybe a one block which is very discrete, a small segment is blocked, but it is about 90% and patient is having history of chest pain. So we always advise them to undergo an angioplasty and we dilate with a balloon and then put a stent. So nowadays what we are using is a drug-eluting stent. That's called as DES, because when you put a drug-eluting stents, we develop reblock chances are very, very less. So it can be done for a patient who is having a single or 2 blocks. But if they are having a multiple blocks, then we always advise Dr. Dixit to take over and then do the surgery. It is not that every patient can undergo an angioplasty or every patient can undergo a bypass. So it is a patient who has got a discrete block. We call it a small segment block.
Right.
Very significant block, more than 75 or 80%, and patient is having symptoms. Then we tell them to undergo an angioplasty and put a stent.
Right. Dr. Dixit, what is bypass surgery?
The name itself suggests that we bypass certain things.
Right.
Whenever there are blocks in the coronary artery, one of the problem is that the blood supply to that area is hampered. So one way which Dr. Prabhu mentioned is that you open the block and put a stent there so that the passage is cleared. Now when that is not possible, then what we do is we take a different conduit, either from the chest or from the hand or from the leg, another blood vessel, and then we connect it from one of the blood vessels to this coronary artery beyond the block, so that we provide an alternate pathway for the blood to flow and bypass this block. So whenever there are multiple blocks, we do multiple bypasses. So this is called as bypass surgery.
So that is offered only to patients who have more than 2 or 3 blocks?
Yes, normally.
Right. But doctor, could it be a scenario where a patient already has undergone angioplasty, has developed blocks and then has been offered a bypass surgery? Could that happen also?
So one of the things we have to understand is ischemic heart disease means that it is, if we do not take care of the risk factors, it is only going to progress. Now any procedure done, either a stent or bypass surgery, it is a palliative, it is not a curative. You understand? Unless you take care of your diabetes, take care of your hypertension, take care of your weight, take care of your diet, take care of your stress management, then only the disease can be controlled. Otherwise it is only going to progress. And that is why it doesn't mean that once you undergo bypass surgery, undergo a stent, that means you can do whatever you want. You know, that is the time when you have to really look at your life and start modifying your lifestyle. And that lifestyle modification is important. Maybe about 10 to 15% of the people who undergo stent or who undergo bypass surgeries, they need another type of intervention later in life. It does happen. We have seen people who, you know, go back to their smoking, who go back to their sedentary lifestyle, who initially do it for about 3 months, 4 months or 6 months, and then they slip back into their old life. These are the patients who come back to us with problems.
Right. Dr. Prabhu, what would you recommend as post-angioplasty care to your patients?
My patients, when they have already undergone an angioplasty and stent, I always tell them that first important is the drugs which he is taking. Because there are some blood thinners in that particular medications. So because if they even stop for a day or two, then the stent can occlude and form a thrombus there. So the most important is continuing a medications without skipping it regularly.
Yes.
That's a one important aspect. And then control of their blood pressure, diabetes, and a regular exercise. And I always stress them, all my patients, to relieve their stress, do an yoga and pranayam. That's also very, very important things. So medications are important, control of their risk factors, what sir was telling, we must stress on that. And regular, every person who has undergone either not only just bypass or angioplasty, they must have a walk for minimum 45 minutes regular. It can be a brisk walk, it can be a regular walk, but they must walk for 45 minutes along with doing a yoga and pranayam.
Yes. And Dr. Dixit, what would you advise your post-CABG or your post-bypass patients?
As we mentioned, taking medicines is very important.
Right.
They should not skip those medicines. Initially, after surgery, when they go back home, we tell them that they should stay in the house for 2 weeks, and after 2 weeks they can go out, they can move around. And they usually get back to their work in 3 to 4 weeks. Because we cut this bone takes about 3 months to heal. So we tell them not to lift up weight, avoid injury, avoid driving, because sometimes you can hit the steering wheel.
Right.
So we avoid all those things and control their risk factors. Make sure that their cholesterol and their diabetes and their weight, everything is under control. And they go for a regular walk. So if they keep doing this, they should be fine. Now what happens is with the advent of minimal access surgery, where we take a small incision and do a bypass surgery and all, they return back to work very faster.
Yes, that was my next question. Can they go back to their normal life after a bypass surgery?
They definitely, almost, they have to go back. The whole idea of operating them is that they should go back to their normal life.
Right.
So they should feel that, they should understand that it is one step, that they should get back to their normal life as early as possible. People who go back to their normal life as early as possible are the one who get benefit of these bypass surgeries much more than those people who still remain patient in spite of
being operated. So doctor, how can we prevent ischemic heart diseases?
Well, that is a $1 million question. One of the way to prevent ischemic heart disease is to prevent risk factors.
Right, because that's
now,
what
as we have discussed earlier, stop smoking, no tobacco in any form. That is first thing. Second thing is, if you are diabetic, to control your diabetes. If your cholesterol is high, with the statins to control your cholesterol level. Regular exercise, walking for about 45 to 60 minutes regularly is very important. Controlling stress is important. Above all these things, what we find nowadays, there is a lot of work going on in these areas. The most important thing that people say is their diet.
Yeah.
As long as they are active physically and they take regular diet. Problem with almost everything today is excessive eating and less activity.
Right.
So this is what is causing. If you reverse it, excessive activity and less of eating, then your these problems of hypertension, diabetes, as well as, so these are, we call it as, this happens because we call it what is called as metabolic disease.
Right.
And people who are sedentary, who eat too much, they'll go back to this sedentary life. And this metabolic disease which happens is because of the insulin resistance.
That develops.
When they become insulin resistant, then they start developing hypertension, diabetes and other things. So we have to prevent metabolic disease. If we have to prevent, means we have to prevent insulin resistance, if we have to prevent the heart disease. So, looking at person's metabolism and making sure that he eats not too much. He should eat whatever
What is
is
required by
necessary,
their body.
but not too much or excessive eating, and less of activity. These two things if people avoid, then we may be able to control. These things.
Dr. Dixit, I'm very curious to ask, does the type of oil that we consume, or like for that matter coconut oil or ghee, have some effect on ischemic heart disease?
There are studies which have been done which suggest that saturated fat, if you eat too much of saturated fat, these are the fat which can cause problems.
Right.
The best fat would be polyunsaturated fat or monounsaturated fat.
Yes.
These are the thing which can do it. But per se oil is only causing heart disease is also wrong.
Yeah.
You have to restrict all these things. But more important is calorie intake has to be reduced. Plus walking has to be increased.
Yes.
These are important things. Whichever oil you take, it is preferable that you take polyunsaturated like soya oil, palm oil. These are much better. But to say that only if you stop eating coconut oil, your heart will be fine, that also is wrong.
Is wrong, right. Doctor, now this is ischemic heart disease. There are other diseases that also affect the heart, like you said. So what is rheumatic heart disease all about?
Rheumatic fever is a fever which affects the joints. So these are the where during childhood, the knees, especially big joints like knees and shoulders, they become swollen and they become inflamed, and that is because of rheumatic activity. And this is a sequelae of certain sore throat which happens.
Right.
And if taken proper care, then it can be cured at that stage. But if it is left untreated and repeated attack of rheumatic fever, once you get a rheumatic fever, there is a chance that they will have repeated attacks. The repeated attacks of rheumatic fever leads to heart disease. And this is what we call as rheumatic heart disease.
Right. So is there any, what are the treatment modalities for it?
The mitral valve, there are 4 valves in the heart. Mitral valve is the one which is commonly affected. The way it affects initially when the rheumatic is active in the heart, that time the valve leaks. But most of the time with medicine it gets cured. But as a sequelae or a scar of that rheumatic heart disease, the valve becomes very small. And before it advances to a greater stage where it becomes irreparable, we can repair it with a balloon, which Dr. Prabhu will explain to you how balloon can be done. And if the valve is badly diseased, which takes about 10 to 15 years of time from the onset of rheumatic fever, then the valve has to be replaced.
So that is called valve replacement surgery.
Valve replacement surgery.
Right. So Dr. Prabhu, what is the balloon therapy that you have in valve disease?
Yeah, I mean, whenever there is a rheumatic heart disease involving the mitral valve, if the valve is, like what sir was telling, if it is not damaged much, only it is narrowed, then without surgery, we put a catheter through the groin and then dilate the valve. With the balloon, the valve is dilated and make it bigger, so that his problem of breathing problem will be less. But for this also, all these people have to take a medication which is called as Penidur injection. We give it at least once in 3 weeks, has to be given for minimum age of 40 or 45 years to prevent further infection on the valve. Otherwise, they can come back again with a bad damage on the valve, restenosis or valve leakage. So that time they may have to go for a valve replacement.
Right. Dr. Dixit and Dr. Prabhu, what would be your take-home message to our viewers on the heart disease is mostly the ischemic heart disease that affects a big population of India?
My take-home message would be, always remember you got only one heart.
Right.
You understand? You have to take care of it. If you don't take care, who will
not
take
in a
care
pair.
of it? The best way to take care of your heart is that be active. That is important thing. Eat whenever you are hungry.
Yeah.
And take each day as it comes.
Right.
There is no point in thinking about future and getting stressed today.
Yes.
So avoid stress and make best of the day which you have got.
Yes.
Maximum whatever you can possibly do it.
Yeah.
You and be happy always.
Right.
Nobody can make you unhappy until you permit them to make you unhappy.
Yes, that's a
So
good
as long as you are happy, as long as you think you got one heart, keep doing your work.
Yes.
And become busy, physically active.
Right.
Walk every day.
Yes.
And emotionally be always in a joyous mood. I think you should be able to avoid heart disease.
Yes. Dr. Prabhu, what are your thoughts?
Yeah, most important message is we are seeing a lot of youngsters at the age of 30 years, 25 years, 20
Yes.
years. I am seeing a patient with a heart attack. So I think it's all because of the stress.
And the lifestyle.
And
also.
the lifestyle. So all these things, I think they should take care of it, because once a person at the age of 25 years, if he develops a heart attack and damage, so it is whole life is lost.
Affected.
So I
Yes.
think we should be very happy in life, what Dr. Dixit was telling, and make sure that prevent all your risk factor. And most important, I want to give a message is, everyone at the after the age of 40 or 45 years,
Yes.
you must have regular checkup of cholesterol, sugar, ECG, and an echo if possible, and stress test. At least once in a year.
Once in a year.
For you can, if you don't remember, get it done on your birthday. Get
Yes.
all these tests done on birthday, so that you can
Remember
avoid
to do it
having
every
your
year.
heart attack.
Yes, right, doctor. Dr. Dixit and Dr. Prabhu, thank you so much for taking time out from your busy schedule and being with us here in the studio and sharing your views on ischemic heart disease to our viewers. Dr. Dixit and Dr. Prabhu are both available for consultation at Arihant Hospital in Belgaum, and they are also available in Goa every month for consultations. Thank you, doctor, so much for coming here.
Thank you. Thank
Keep
you.
watching Prudent. Take care
Thank
of your
you.
heart and stay safe.